Every 40 seconds, somewhere on this planet, someone has a stroke. By the time you finish reading this sentence, another brain has been hit. Every year, stroke kills almost 6 million people worldwide. It is the second leading cause of death on Earth. And it is the single biggest reason people end up with permanent disability. Unable to speak, unable to move, unable to recognize the people they love. But here is the part that should change everything about how you think about this disease. In a huge number of cases, the brain sends very specific warning signals hours or even days before the big stroke happens. Not vague signals, not subtle hints, clear, identifiable warnings that your body is trying to get your attention with. The problem isn't that these warnings are invisible. The problem is that nobody ever taught you what they look like. I'm Dr. James. I've spent 30 years in medicine watching patients survive strokes that were entirely preventable, and watching families destroyed by strokes that the brain had warned about days before, warnings that were dismissed, explained away, or simply never recognized. That ends today. Stay with me until the end, because the fifth warning sign is the one that surprises people the most, and it may be the one sitting quietly in your own life right now without you even knowing it. When people say stroke, they're actually talking about two very different events happening inside the brain. The first is a hemorrhagic stroke. A blood vessel in the brain bursts. Blood pours into or around the brain. A clot forms that compresses brain tissue. Many of these patients die. The second, and far more common, is an ischemic stroke. The vessel doesn't tear, it gets blocked. Blood flow stops to part of the brain, and brain cells in that zone start dying in roughly 4 to 6 minutes. Ischemic strokes make up around 85% of all strokes. That's what we're talking about today. To understand why every single minute matters, you need to understand how demanding your brain actually is. Your brain weighs roughly 1.4 kilograms, about 2% of your body weight, but it consumes around 20% of all the oxygen you breathe and 25% of all the glucose circulating in your blood. It is a control center that never turns off, and it needs a constant uninterrupted fuel line. Cut that fuel for even a few minutes, and cells start dying in ways that cannot be reversed. That is why doctors say stroke is a race against time. It is literally a race to save brain tissue before it is gone forever. Here's what most people fundamentally misunderstand about stroke. For a brain artery to suddenly block, the groundwork usually took years. The walls of the vessel have been quietly damaged. Cholesterol and clots have been slowly building. The opening has been getting progressively tighter, month after month, year after year. This is not an explosion out of nowhere. It is the final step of a long and predictable process. And along that road, your body usually sends warning signals. In medicine, those early warning shots are called a transient ischemic attack, a TIA. Transient simply means temporary. It comes and then it goes. Picture a carotid artery, the main neck artery that carries blood from your heart up to your brain. Over years, a fatty plaque has formed on the inner wall right where the artery branches. The opening slowly narrows. Then at some point, the already tight vessel goes into a brief spasm. Blood flow stops for seconds or minutes. The brain area fed by that artery essentially blacks out. You feel or see a stroke symptom. Then the spasm relaxes. Blood flow returns. The symptom fades. You think you're fine again. What the research actually shows is that a TIA very often comes directly before a major ischemic stroke, typically within the next 72 hours. Those 3 days are your window, the window where the disaster can still be prevented. Most people don't use that window because the warning episode was short, strange, and then it went away on its own, so they talk themselves out of taking it seriously. These episodes usually last from about 30 seconds to 10 minutes. That is exactly why they slip through the cracks. You can be in your kitchen, in the shower, getting out of a car, and by the time you stop and think, the symptom has already passed. But each one of those episodes is your brain sending a final, very clear message. I am about to be in serious trouble. Warning sign 1, temporary blindness in one eye. The first warning sign. You get up, walk toward the kitchen, and suddenly one eye goes completely dark or foggy, like someone pulled a black curtain over that eye or smeared the lens with gray mud. You blink a few times, maybe rub the eye, and within seconds or a minute, your vision comes back completely. So you blame it on standing up too fast, too much screen time, getting older. In reality, that curtain is almost always a tiny clot or a small fragment of plaque that broke off from the wall of your carotid artery, traveled upward, and briefly plugged the artery that feeds the eye. The artery to your eye is not some random isolated tube. It is a direct branch of the internal carotid artery, the same artery that feeds your brain. When that clot wedges into the tiny eye artery, blood cannot get through. The retina loses its blood supply for a moment, and you see darkness instead of a clear image. When the clot drifts away and blood flow restarts, the vision returns, and you feel lucky. You are lucky, because that exact same clot could have traveled 2 millimeters to the side into a brain artery. And then instead of a 1-minute blackout in one eye, you are looking at permanent loss of speech, paralysis of an arm and leg, or death. Doctors have a name for that one eye blackout, amaurosis fugax. It literally means fleeting blindness. Neurologists treat that phrase like a fire alarm. If a patient describes that episode, they get urgent evaluation immediately, because the risk of a real stroke in the next hours is high. Do not explain this away, ever. Warning sign 2, sudden numbness or tingling on one side. The second warning sign, sudden numbness or tingling on one side of your body. It can be the whole arm, just the hand, half the face, or one full side of the body. It feels like pins and needles, like cotton, or like that body part has turned into rubber. The critical detail is that it comes out of nowhere while you're just sitting, walking, or talking. It lasts a few minutes, then disappears completely on its own. You've probably slept on your arm before, where nerve compression causes numbness that clears when you move. That is completely different. In that case, your brain is fine. You simply squeezed a nerve. With a TIA, the problem is not in the arm. It is in the brain area that processes sensation from that arm. And it has nothing to do with your posture or position. One more thing worth knowing. Stroke symptoms are usually one-sided, because each brain hemisphere controls and senses the opposite side of your body. When both hands go numb evenly, that more often points to spine issues. But sudden one-sided numbness that resolves after a few minutes is a strong reason to get checked for TIA risk immediately. Do not wait, do not assume. Warning sign 3, sudden loss of coordination. The third warning sign is one people consistently explain away. A sudden loss of coordination, what people describe as a drunk walk without any alcohol. You are on a flat, familiar surface, and out of nowhere, your foot lands in the wrong place. Your leg feels weak or rubbery. You stagger sideways into the wall for a second, or you're hit by a sudden, violent spinning sensation that makes you grab a chair or a door frame, even though you were completely still. The part of your brain responsible for keeping you balanced and coordinating smooth movement is called the cerebellum. It sits low in the back of your skull. It constantly calculates where your body is in space and how each muscle should fire, so you walk straight instead of staggering. The cerebellum gets its blood supply from arteries that run up through the bones of your neck into the back of your head. If blood flow in those arteries drops sharply, even for seconds, the cerebellum essentially glitches. And that is when you suddenly veer sideways, misstep, or feel violent dizziness for no obvious reason. I have watched patients write off these episodes for months. Bad shoes, I was tired, must be my blood pressure. Only to discover later those were cerebellar warning attacks that nobody took seriously. Benign dizziness usually has a clear trigger. Rolling over in bed, turning your head quickly, a known inner ear condition. But spontaneous, intense dizziness combined with any trouble walking straight should be treated as a possible TIA until a doctor rules it out. We are halfway through, and I need you to understand something before we continue. Every single warning sign I've described so far, the blind eye, the numb arm, the drunk walk, each one lasted minutes. Each one went away on its own. Each one felt like nothing serious. Each one was the brain's last attempt to be heard before something permanent happened. The next two warning signs are the ones that get ignored the most. Pay very close attention. Warning sign 4, sudden speech breakdown. Before I explain this one, I want to be very clear about something. If you occasionally cannot remember your neighbor's name, or you temporarily forget the word for something simple, that is not a stroke warning. That is a completely normal tip-of-the-tongue moment that happens more when you're tired or stressed. What concerns neurologists is something completely different. When your speech suddenly breaks down so completely that even you feel something is seriously wrong. There are two main speech areas in the brain, both usually in the left hemisphere. The first helps you form words and send clear instructions to the muscles of your tongue, lips, and jaw. When that region loses blood flow, you may understand everything people say. You know exactly what you want to answer, but you cannot get the words out. They come out slurred, chopped, stuck. The second area helps you understand speech and organize your own sentences so they make sense. When that zone is in trouble, a person may speak fluently but say complete nonsense, words that don't connect, sentences that mean nothing, and they may not understand simple phrases directed at them. If either of those speech problems shows up suddenly and then fades after a few minutes, that is classic for a TIA. Not, I was just tired. You cannot ignore sudden broken speech simply because it's self-corrected. That is like your home alarm going off, stopping by itself, and deciding it was probably nothing. It was not nothing. Warning sign 5, the surprising one. The fifth warning sign surprises people the most. And I promised you, at the beginning, this one might already be present in your own life. It is a combination of two things, a specific skin condition and new, unusually strong headaches. The skin condition is vitiligo, patches of pale or completely white skin where pigment-producing cells have stopped working. Vitiligo is an autoimmune process. The immune system begins attacking your own pigment cells as if they were foreign invaders. When your immune system goes off target like that, it often does not stop at one organ. In many people, that same autoimmune process can quietly inflame the inner lining of blood vessels. That lining, called the endothelium, is a microscopically thin layer of cells that coats the inside of every artery like a super smooth non-stick surface. When the endothelium is healthy, blood components glide through and nothing sticks. When it is damaged by inflammation, it becomes rough and scarred, and things start to cling. Cholesterol, platelets, inflammatory proteins, forming the seeds of plaques and clots over time. Vitiligo alone does not doom you to a stroke. But if on top of that, you develop frequent, unusually intense headaches that don't fit your usual pattern, that combination deserves a proper vascular evaluation rather than a wait-and-see approach. If you have vitiligo, and your headaches have changed in character recently, tell your doctor. Use those exact words, changed in character. That phrase will get you taken seriously. Now I need to tell you what actually wrecks your vessels from the inside. Because this is where one of the biggest myths in medicine lives. The myth: my cholesterol is normal, so I am safe from stroke. Stroke risk is not just about what is floating in your blood. It is very much about the condition of that endothelial lining on the inside of your vessels. Think of a non-stick pan. While the coating is intact, nothing clings. Once you scratch and damage it, everything starts sticking. The first major enemy of your endothelium is chronically high blood sugar. When your body doesn't make enough insulin or your cells become resistant to it, you can have plenty of sugar in the blood while the vessel lining cells are starving. Starving cells get damaged, lose their shape, and can peel off the inner surface, leaving behind rough scar-like patches that become perfect landing pads for cholesterol, platelets, and clots. This process starts years before anyone officially tells you that you have diabetes. Even mild prediabetes, where your glucose is only slightly above normal, is enough to injure the endothelium quietly for a very long time. The second major enemy is smoking. With every cigarette, toxic compounds hit the inner surface of your vessels and cause direct chemical damage and inflammation. At the same time, nicotine and carbon monoxide make your blood thicker and stickier, increasing how easily clots form. A damaged, inflamed vessel wall plus thick, sticky blood equals ideal conditions for a clot to plug a brain artery. Smokers have roughly 2 to 4 times the risk of an ischemic stroke compared to non-smokers with similar cholesterol and blood pressure numbers. Here is something most doctors never explain clearly enough. Many people are terrified of high blood pressure and relieved when their reading comes back normal or low. But an ischemic stroke often happens not at the peak of blood pressure, but at a relative low point. Here is why. Picture a brain artery already narrowed by more than half because of plaque. It is like a water pipe someone is squeezed in the middle. As long as pressure in the system is high enough, some blood still squeezes through that tight segment. But if overall pressure falls, the flow through that narrowed point can drop to almost zero, especially if a small clot gets stuck there and the system doesn't have enough push to move it along. At night while you sleep, blood pressure naturally falls by roughly 15 to 20%. This is normal physiology. But if you already have a plaque-narrowed artery, that nighttime drop can be enough to turn a partial blockage into a complete stop. That is why some people go to bed feeling completely fine and wake up with stroke symptoms, or don't wake up at all. If you have experienced even one of these 5 warning signs, even if it felt small and vanished in under 10 minutes, here is exactly what you need to do. You have roughly 72 hours where a great deal can still be done to prevent a full stroke. First, do not drive yourself anywhere. Losing vision or arm control for even a few seconds at highway speed is life-threatening for you and everyone around you. Second, do not take blood-thinning medications on your own. There are 2 main types of stroke. One involves a blocked vessel, the other involves a bleeding vessel. Blood thinners can help in one situation and accelerate death in the other. The only way to tell the difference is with brain imaging in a hospital. Never self-medicate. Third, body position matters while waiting for help. Lying flat is generally better than sitting upright because it helps blood flow to the brain. Keep the head neutral, not bent sharply forward and not thrown back. Fourth, ask your doctor about these 3 evaluations. 1, carotid duplex ultrasound. This shows both the structure of your neck arteries and how blood is actually flowing through them. If your carotid artery is narrowed by more than 70% by plaque, that is not a question of whether a stroke will happen. It is a question of when. 2, glycated hemoglobin, HbA1c. This reflects your average blood sugar over the past 3 months. It catches prediabetes that a single fasting glucose test misses completely, and prediabetes is already damaging your vessel lining silently. 3, Holter ECG monitoring, a 24-hour heart rhythm recording worn while you go about your normal day. This catches atrial fibrillation, a heart rhythm problem where the upper chambers quiver chaotically instead of beating steadily, causing blood to churn and clot inside the heart. Those clots travel to the brain and cause some of the most severe strokes seen in medicine. When atrial fibrillation is caught and treated, stroke risk in that condition drops by 60 to 70%. Stroke is not a lightning bolt from a clear sky. It is a predictable event that usually follows years of silent vessel damage, and it almost always announces itself in advance. You now know the 5 warnings your brain sends before it happens. Temporary blindness in one eye, sudden one-sided numbness or tingling, abrupt loss of coordination, sudden serious speech breakdown, and vitiligo combined with new unusual headaches. Any one of these showing up for the first time, even if it vanishes in a minute, is a reason to speak to a doctor urgently. Write down what happened, when it happened, how long it lasted. Bring that list to your doctor and ask directly, could this have been a TIA? Should I have a carotid ultrasound, an HbA1c, and a Holter monitor? Those questions could save your life. And if this video reached someone you love, someone who dismissed something strange that happened recently, send it to them right now. Not tomorrow, right now. Because somewhere in the next 40 seconds, another brain is going to be hit. Make sure it isn't someone you care about. Subscribe to this channel. I post every single day because your health after 60 cannot wait. Take care of yourself.